optimal functioning, and when we see yellow to orange to red, it's 1 to 2 to 3 levels too high of a speed, and the blues mean 1 to 2 to 3 levels too low of a speed. Okay, so let's look at some maps. Here is, and I'm only going to show you one raw data so you can get the sense of how it's different. You can see how some of these areas, for a 16-year-old with ADHD, some of these areas are loosening up, or they stay loose across time. And really, this is only across, not even a second, it's 15 seconds. You can see how we have loosening of some of the areas. Loosening is slowing. It's slowing of brain functioning, which results in ADHD. So let's see what this would look like on a brain map. Okay, what it looks like is much too much theta, or slow processing speed. It's that speed that creates drowsiness or shifts us into sleep. Simultaneously, some people with ADHD do not have enough low beta, or that faster kind of optimal processing speed for cognitive function. So it's a double whammy, too much slowness and not enough perfect fastness. So an analogy that I use in the office all the time is in ADHD. It's like someone's driving and they have their foot on the gas at 45 to get around town, perfect speed. But if you have ADHD, your pedal is to the metal for the brake. Simultaneously, your foot's not even on the gas at 45. It's on it at 25. So cognitive processing is not only happening more slowly, it also has the brake on it as well. And you know the key to success, if you've watched any of my neurofeedback videos, the key to success is taking that foot off the brake, pushing it on the gas a little bit better, a little bit more ideal, using neurofeedback therapy. But we'll get there. We will get there. Okay, so now speech and language impairment in a 5-year-old. 5-year-olds are the perfect people to get in for neurofeedback therapy or for traditional therapies because their little brains are more plastic, more neuroplastic than older brains. And our older brains, thankfully, are still plastic as well, but we want to capitalize on it. So actually, this is a before and after neurofeedback therapy, and these are the slower speeds right here, 1 to 8 hertz. And you can see how around Broca's area and Wernicke's area across the back of the brain also is running much too slowly. And in this after, you can see how there's dramatic improvement in 1, 2, 3 hertz, 4 hertz even. So there's dramatic decline of too much slowness, of too much braking. But the point being is that a speech and language map is too much slowing in the speech areas of the brain. Sensory processing brain function. So kids that have sensory aversion especially have much too much fastness. This is beta. So when we see too much fastness across the sensory motor cortex, and a lot of times it creeps into the frontal lobe also, and if you're a therapist, I don't need to tell you this, that many times kids that have sensory processing disorder or challenges also have diagnoses in other areas. So they have ADHD, they struggle with anxiety or have OCD, they may have a speech and language problem. So it is a brain that is running much too fast. So if you just think about it, how the brain's processing information, when you're in the zone, the information comes in, your body processes it, and then it leaves. It doesn't hang around. If the brain is running too fast, that information as it comes in really shocks the system because the system is hypervigilant and the system can't handle the input. And as the input's trying to come in, it creates a fight or flight response in the brain. And that's what we're looking at here, much too much fastness. Fight or flight just based upon environmental stimuli. So that can be tactile, that can be auditory, it can be sensory in many different ways. So too much fastness, sensory processing disorder. Now, sometimes kids also have too much slowing or have too much slowing instead of too much fastness in the sensory processing areas of the brain. And what that can lead to is sensory seeking behaviors, because those areas of the brain are running too slow and they feel like they need stimulation. So those are kids who like to bounce on trampolines, maybe need some vestibular stimulation because those auditory processing areas in the brain are running slow. So if a kiddo is uninhibited and really seeks out sensory information into their system, they're probably running slow. And many times kids' brains can be running both too slow and too fast, too much braking and too much gassing simultaneously. Okay, autism brain functioning. I just wanted to talk about this very briefly because I know many times people think that autism is like ADHD on steroids. It is not. It's a very different pattern. There is too much slowing, as you can see over here, and a little bit of too much fastness, and you can read it here also. But you can see alpha, which is that chill, relaxed mode, is much too low for kids that are on the spectrum. So their systems are not able to relax and just be. It's either running too slow or too fast simultaneously. And really of interest is back here at this area in the parietal lobe, there's a star formation. So an autism spectrum disorder QEEG brain map really is one of communication. Communication between brain areas is impaired. So we do see these differences in speeds, but communication between the brain areas is impaired, which is really throwing functioning of those areas off. An analogy I use about the brain areas in terms of how they communicate is, I think about all those circles we looked at, all these little dots are those circles we looked at on that system. Those circles are like players on a team. So they have to hold their position, but they also have to communicate with each other with the perfect amount and the perfect speed. And that is not happening for kids that are on the spectrum. Head injury. If you're a therapist, physical therapist, occupational, speech pathologist, you've probably seen your fair share of children that have head injuries or have anoxia at birth, so really trauma to the brain. People have stroke, it's a similar type of pattern, or people just have had a physical head injury. What we see here is we see the brain power is knocked low while it's simultaneously knocked slow. So the power needs to be boosted in the brain so that those areas can function again. And you can see it compared to the green optimal. Anxiety brain functioning pattern. I put it in here so that you could just connect the dots, I guess, for the sensory processing brain map. We see beta and high beta, that fast and extra fast speed, is being used much too much in kids that have anxiety. And again, many times this can lead to OCD. OCD are behaviors that are trying to calm the fire in the brain. So when a person's brain, I call it fire because it's yellow, red, and orange, it looks like flames. When there's a fire in the brain, many times the behaviors that people have are trying to dampen that fire or put it out. So in OCD, when there's different types of cleanliness behaviors, we'll just take, for example, trying to make things clean is trying to dampen the fire. And you'll see in a few slides, the recommendation for therapists and for parents actually is to try to understand what the behaviors that your child or even your significant other are demonstrating, what it means for their brain function, so you can think about how to help their brain functioning, not necessarily